So in 2 minutes, we'll go ahead and get started. I know that we have some people tuning in on Facebook as well. So thank you for joining us today for our Care Connect convo with Dr. Melanie Mouzoon. She is a pediatric hospitalist, a fellow of the Academy of Breastfeeding Medicine, and our managing physician for immunization practices at Kelsey-Seybold. We're logging in with Zoom and we're streaming to Facebook Live today. So we're going to give it just 2 more minutes for everyone to tune in, and then we're going to go ahead and start our conversation about COVID-19 and children. So we have lots of great questions prepared today for Dr. Mouzoon. But if you have any questions, we highly recommend you to go ahead and ask us. We want to make sure we give you guys all the information that you need about COVID-19 and children. We do have a Q&A box in Zoom. So if you have a question and you're logged on via Zoom, if you could just type it in there, we would appreciate it. And if you don't have Zoom, so if you're logged in through social media, you can go ahead and just ask your questions in the comment box for the live feed. We'll be monitoring that feed as well and answering questions from there. We do only have about 30 minutes with Dr. Mouzoon today, so if we don't answer your questions during this time, we will be sending out an email recap with the questions submitted and the answers to everyone who registered to attend today. So don't get frustrated if your question doesn't get answered. We're just on a little bit of a time limit here today, so we will send out an email recap to everyone as well. Well, it's 1:30 now, so I think we're going to go ahead and get started. Just a reminder that if you are joining us via Zoom, if you could make sure that your microphone is muted. We want to make sure everyone can hear Dr. Mouzoon and we don't have background noises. We know a lot of us are working from home and have kids and pets and things like that in the background. So if you could just make sure your microphones are muted, we'll go ahead and get started. So Dr. Mouzoon, I know I did a brief introduction about what you do at Kelsey-Seybold and just gave a little recap of your titles, but can you tell us a little bit about what you do in the hospital as a pediatric hospitalist?
Okay. Yes, I'm a pediatric hospitalist. I'm a general pediatrician, and I take care of Kelsey-Seybold's newborn population primarily at Women's Hospital of Texas and also at Texas Children's Hospital. I have experience in taking care of older children as well, but my practice is now limited to newborns primarily. I do breastfeeding support, and I do the initial evaluation and care for our sick newborns as well newborns.
Awesome. So you're obviously very familiar with COVID-19, also known as coronavirus. Can you tell us do we know how long this novel coronavirus has been around?
So the earliest reports of it were in late December in China. However, there are researchers who have been studying bats. You know, everybody has their own niche in the world. And so there have been researchers studying bats, bat droppings and viruses that bats produce in areas of China and elsewhere in the world who have found viruses very similar to this. So this virus has been around for a while in animal populations and only came to human populations probably in early December, I would guess, and first made people ill in late December in China.
Another question we've been receiving a lot is, what is a coronavirus?
Okay, so viruses in general are a package of either DNA or RNA, so a package of genetic material. The coronavirus is a package of RNA, and it's got a coat surrounding it, and that coat basically has particular qualities. Every virus coat has its own special protein coat, and the protein coat of this particular virus looked to the original researchers like little crowns, and so that's why it's called coronavirus. Corona means crown.
Okay, so is the virus changing from what our scientists and our physicians were studying it from the time we saw it first appear in December to now, or is it the same virus?
So there are basically 4 families of coronaviruses, and most of them cause the common cold. This coronavirus, like other coronaviruses, when it replicates, which means when it makes more viruses in cells, it makes a bunch of changes in its DNA happen just by accident. The most of those changes will cause the virus to die. So most of the ones that survive are the ones that are just like the original virus. The fact that they have a lot of genetic mutations each time that they replicate means that it's potentially going to change over time. But so far, it has not changed significantly. So there's concern that it could change over time, that it might make a minor change that wouldn't kill it. Just by accident. It doesn't do this intentionally. It just has mistakes in the way it reproduces itself. And that could happen in the future, but right now, it looks like it's staying pretty much the same as it was in early December.
We've been hearing on social media and local news, national news about a vaccine or an immunization being developed for coronavirus. Can you update us a little bit about that and maybe explain the process behind creating a vaccine?
So vaccines are a copy of the protein code of the virus. Our bodies are capable of recognizing non-human proteins, and they do that all the time, every day, day in and day out. And so a vaccine is a copy of a foreign protein for an organism that we don't want to infect us. So for example, the HPV vaccine is a copy of the protein code of human papillomaviruses. And so we are trying to develop vaccines, not me, but other vaccine scientists are trying to develop vaccines that look like the coronavirus, but don't have the viral messenger RNA inside of it. And so there are a number of different techniques for doing that. Some of them are solely based upon what that the viral's RNA looks like. They can produce a copy of the protein code just from knowing the genome of the virus. And so there are some people researching that. This virus is also very similar to the SARS virus that circulated 1.5 years or 2 years ago. And so there are researchers who have already produced vaccines against that virus, and there's hope that there will be some crossover protection. All in all, there are about 12 different candidate vaccines being worked on right now.
Do we know how long it's going to take until a vaccine will be available or be able to be mass produced?
So unfortunately, the history of vaccine production is only about 1 in 4 at best of vaccine candidates really work and are acceptably safe. In order for us to be able to distribute vaccines widely, we need to know that the vaccine doesn't cause any bad side effects, and we need to know that it works. And so when researchers pick a protein to copy, they are hoping that it's a protein that, number one, the body will recognize, and number two, the body will then use as a target for the immune system to hit. And so if it doesn't do that, then the vaccine won't be effective. And vaccines, as we all know, sometimes cause some side effects, a little fever or sore arm or whatever. So the side effect profile has to be acceptable. It has to be minor side effects that don't make us very ill. And so it really, we don't know of the numerous candidate vaccines which one is likely to work the best, and they all will need first safety trials on a few individuals, a pretty small number of individuals, say 100 or fewer, and then they will need wider trials among people who are being exposed to the virus to see if they protect them.
So we've seen an initial wave and a surge of the coronavirus spread through the US, especially on the East Coast in New York and that area. Do we expect to see a second wave of this in the fall, where this will be a seasonal virus that comes back, sort of like the flu?
So what's going to happen really is going to depend on the region and how quickly the regions reopen. New York has had such significant spread of this virus that it's really potentially going to be a place where they don't have as much of a second wave because they've had such a horrendous first wave. That will be true if people develop immunity to the virus. So we know that about 80% of the people who catch this virus do not have any symptoms from it. We don't know whether those people will be permanently immune. Maybe the immunity will only occur among those who have a significant illness. So what will depend on is how much of the population has immunity, because the virus isn't going to go away. It's not going to go away seasonally or otherwise. It's going to be present as long as there are vulnerable people in the population who come in contact with it. So I'm a little more worried that our second wave will occur in about 2 weeks as Texas starts to reopen, because the more we come in contact with other people, the more this virus is going to find people who haven't had it and infect them, and then they will go on to infect others.
I know as a parent myself, we're wrapping up our school year, but we're already talking about kids going back to school in the fall.
Mm-hmm.
Is there a cause for concern or worry that once kids get back to school, we'll see another wave in kids at that point?
So children have fortunately not had a lot of symptomatic illness. Not that there haven't been children who've been sick and even hospitalized from this virus, but the majority of children, probably well over 80% of children who've caught this virus, actually don't get significantly ill with it. And I think that the lockdown of the schools was really because of our concern that children, while they weren't sick with it, would be spreading it to others. So it's going to be more of a public health decision rather than a decision really to protect the children. We're trying to protect the older people that those children come in contact with. I think that we will definitely have to reopen schools at some point, and we'll have to kind of tolerate some level of community spread in order for us all to develop herd immunity, unless we choose to hold the economy down until we have a vaccine. And while people have, talked about a vaccine in a year and a half, that is an extremely aggressive timeline, and it's much more likely to take a little longer than that. And we can't hold kids back out of school for that length of time. So I think what will happen is we'll have to come to tolerate a certain level of community spread and do our best to limit that spread by wearing face masks, having lots of alcohol hand gel available, carrying it around on your belt and using it frequently, and limiting how much we are in contact with people in a public way.
So I know we talked about schools opening. We actually had a question that came in about daycares.
Yes.
So are younger children who are not school-aged more vulnerable to catching coronavirus? And would the symptoms or signs be different for children who are younger versus children who are older?
So everyone is vulnerable, and the symptoms and signs of infection are pretty much the same across the population, regardless of age. So the most serious illness is the pneumonia, but diarrhea and loss of smell, we've all heard all of these other things that happen. So the pneumonia is the most significant. Infection starts in everyone who develops symptoms with fever, not feeling well, muscle aches, headaches, and then progresses to cough and pneumonia and stomach flu types of symptoms. So regardless of your age, that's really what we're looking for. You won't know if your children have had the infection and not had symptoms unless they test. And probably what we'll be doing when schools reopen will be every child will get screened, just like we're all being screened whenever we go to the doctor's office or a hospital. They'll be screened for fever as they enter the school and be encouraged to stay home with any symptoms at all of illness. And then there will probably be masking in schools, but I'm speculating because, no one has really made those decisions yet.
Yeah. So we were talking about the symptoms of coronavirus a little bit. In the news and social media, they've been reporting that a skin rash may now be a new sign or symptom of coronavirus. Can you tell us a little bit about that?
I think that really a wide variety of people have caught this. and they've had a wide variety of symptoms. Skin rash, I don't think is going to be a defining symptom for this virus. It's more of a mucosal infection, but anytime a virus infects our bodies, it can cause what's called a viremia. It can go throughout the bloodstream to all parts of the body. So, for example, measles and chickenpox cause terrible rashes, and those rashes are because the virus has gotten to the skin. There are many other viruses like cytomegalovirus that usually cause, for example, a tonsillitis, but occasionally cause a rash. And it wouldn't be unheard of to have a generalized rash with this virus, but it's not going to be present in a very large percentage of people. And it's not going to be the definition of whether you got the virus or not.
So if we see our children showing signs and symptoms of coronavirus, when do we need to become concerned that this is now a really serious illness and we need to seek medical treatment?
So any household member, child or adult, who has, cold symptoms, cough, fever, malaise, headache, should basically be separated from other household members as much as is possible. The fact is, though, that most people are contagious before they start developing symptoms. And so if one household member is ill, probably everybody in the household has been exposed. The illness symptoms that are most concerning are ones that seem fairly obvious: bluish tint to the lips and face. That means you're not getting enough oxygen. But the preamble to that really would be more cough, tiredness, inability to catch your breath when you're doing routine activities, needing to stay in bed all day because you don't have the energy to get up. So anything that really makes you unable to carry out your daily activities is of concern. And most people will have several days of really feeling bad before they develop the significant pneumonia. And so, you should call your doctor. And at Kelsey-Seybold, we have a 24-hour call center. So I would encourage you to call if you have any symptoms that are concerning for COVID, whether it's in your child or in yourself. Because we have a good screening process in place and can guide you and can then test you earlier on. And it's important to be tested, and the tests are now more available. It's important to be tested because if it's a cold, it's a cold, and that will be reassuring. And if it's COVID, then we'll know to watch you more carefully, and you'll know to be more cautious around household members.
So you mentioned being cautious around household members. If I, as a parent and a caregiver, were to test positive, how would I care for my kids during that time? Are there special precautions I have to take besides wearing a mask and disinfecting, knowing that I may not be able to completely isolate myself from them?
Yeah, if you're not able to completely isolate yourself, you're really left with masking and disinfectants and really frequent hand washing. And it really is going to depend on the age of the child. You certainly should not be putting a mask on a child under the age of 2. And so if your children are younger, you need to try and see if other household members can help pitch in and care for those younger children so that you don't expose them as much. And really, you do need to try and stay in a separate bedroom, use a separate bathroom facility. One thing I haven't heard people talk about much, and which is important, is if you have diarrhea symptoms, make sure you're closing the lid of the toilet when you flush, because that can aerosolize some of the virus flushing the toilet. So it really is, it's almost an impossibility to keep yourself isolated if you're still responsible for caring for those children. Do know that if you're getting sick enough that you need to be in bed all day, you need to be making alternative arrangements for the care of your children, because you could sicken enough that you might need to go to the hospital.
So what about if we have a new mom or someone who's still breastfeeding a child? Should they continue to breastfeed during this time?
So there are 2 sets of recommendations. One is sort of very fearful of the COVID virus, and the other is very fearful of people not being successful in breastfeeding. And so the Centers for Disease Control and the American Academy of Pediatrics are more concerned about the unknowns about children and infants catching the coronavirus and want to be very careful and cautious in protecting those children. And they recommend that that you separate from the infant and give your expressed breast milk, pump and hand express and give that milk to the infant, but not directly breastfeed. And there is good evidence now from around the world that suggests that babies and infants are very unlikely to get ill from this virus, even with a household member who has it. So the World Health Organization actually has a different approach, and their approach is, you should be doing skin to skin, you should be breastfeeding, you don't need to wash your breasts before feeding each time, you do need to practice good hand hygiene, you do need to wear a mask, but continue to breastfeed, because the loss of breastfeeding, if you pump only and you lose your supply and you're not able to continue to supply breast milk to your child, that also has consequences for illness, and some of those consequences are lifelong. So really they're like two different approaches, and so it's really hard as a pediatrician to know which is the best way to recommend. But I think parents need to be aware that both are valid, that there's not enough science to know in the long run what's going to have been the best choice. And you can either choose to separate if you're very fearful of the virus, or you can choose to continue to breastfeed and just take extra precautions.
We had a question that came in that said, if your child does test positive and needs to be hospitalized, how are hospitals caring for pediatric patients, especially the very young ones who test positive for COVID-19? Are they using the same treatments and protocols as they are with adults for young children?
Most of the treatments and protocols that are being used in adults are part of scientific studies. And those studies are generally not going to include children or pregnant women, simply because of safety concerns. The medications that are being used in some of these adult trials, remdesivir and various malaria medications, are not often used in infancy, and really we don't know if they would be safe for infants. So, and there also are not enough young children, infants, to include in a trial for just infants of any of these medications. So finding out about the safety and efficacy would be difficult. So most children and infants are receiving just care for their symptoms. And so since there's no specific treatment, if a child tests positive but really has mild symptoms, is not having symptoms of pneumonia, difficulty breathing, difficulty holding down food, and unable to get out of bed, if their symptoms are mild, they are best at home. And the children who are being hospitalized are really only those with very severe symptoms that need support, for example, with a ventilator or oxygen.
Do we know at this point if there are any side effects or complications in children from testing positive for the COVID-19 virus after recovery?
No, the vast majority of children will recover completely from this, which is really good news. We know that there are adults who recover who have some chronic issues, some neurologic issues, and other, pulmonary issues, lung issues, and brain issues that can be a more extended recovery. But most of those adults who have that situation are also in those higher risk groups and have had more serious illness. So we really don't know that there are any long-term problems, as long as you have had a pretty uneventful course and a recovery. We don't expect there to be.
So we're going to shift our conversation a little bit. We know that care during the time of COVID-19 has changed. We're all embracing a virtual world right now.
Yes.
So can you tell us a little bit about virtual pediatric care at Kelsey-Seybold? We had some questions that came in specifically with well child visits. Should you continue to get your immunizations and vaccines as scheduled? And what does pediatric care look like now?
So you definitely need to go ahead and continue to make in-person well child visits if vaccines are needed. We know from past illnesses, for example, Ebola in countries in Africa, that when people are afraid to come in and don't get their routine vaccines, then what's going to happen is we'll have this pandemic be followed by some other epidemic of a vaccine preventable disease. So pediatricians around the country are working really hard to make sure that children who need vaccines continue to come in, continue to get those vaccines. At Kelsey-Seybold, we're doing those well visits primarily in the mornings. We've had, thorough cleaning of our facilities at night. We are making sure that we screen everyone who enters our building for symptoms of COVID-19. And then we're making sure that when the children come in for checkups, that they're not dragging along too many unnecessary family members. So each child comes in usually with one family member, and we are in some locations having the families wait in the car until the exam room has been cleaned and is available, and then calling them in. You're able to make your copays or sign in, check in electronically at Kelsey-Seybold locations. We have what's called a geofence, where you can actually sign in through your MyKelsey online when you arrive, and just come in, have that visit as quickly as possible, get those immunizations, and get back out the door. We are requiring that people mask unless the child is under age 2, but family members should mask. And what a virtual visit looks like is a lot like this webinar. So your pediatricians, some of them are working from home doing well child care when immunizations are not needed, and some of them are working in the clinic doing the well child care and sick visits for people who do need to be seen in person. And over a video visit, there are a lot of things in well child care that we can find out from you, and if you're a little bit proactive, you can help us make that visit go very smoothly. So if you're able to weigh your child and measure your child's height, that's important, because one thing pediatricians are really focused on is growth and development. And so they will want to know your child's weight and height if you can give that. They will want to check your child's development, make sure that your infant or toddler is meeting the usual milestones. For example, if they're 12 months old, have they started to walk? Are they cruising around the furniture? That kind of thing. And so they will ask you those sorts of questions. They will probably have you undress your child down to just underwear if it's not, for example, maybe an adolescent visit, but for a toddler visit, so they can get a good look and see that your child looks like they are well nourished and that they're not having trouble breathing and their skin color is pink. If it's an infant, they'll be looking for jaundice. We're able to see quite clearly skin rashes and other concerns that you have. So we're not only doing well child care, but we're doing sick child care by video visit. And in fact, I'm doing some breastfeeding consults by video visit, as odd as that sounds. So we're able to do quite a lot. We will counsel you about perhaps discipline issues that you're having, or behavioral concerns like toddlers who are refusing to eat, that kind of thing. So a lot can be done by video visit.
Do you have any tips for parents who may be trying to manage a chronic condition that their child has?
Yes, I think it's important to make sure that you have an adequate supply of your medications, that you don't run out, because you're not coming in for those checkups that would remind you to refill those medications. Our pharmacies at Kelsey usually will send you reminders and can mail your medications to you, so you don't need to come in for those. And many other pharmacies have similar programs. It's important really to keep up with those maintenance medications. For example, the asthmatics who are requiring, any kind of maintenance inhaled steroids, for example. I think that there's a tendency to think, that some of these chronic medications are not as important in this time. For example, ADHD medications if your child's not in school, that may be something you want to discuss with your pediatrician, whether they need to stay on their medications or not, because ADHD symptoms, for example, can cause household disruption as well. And so it may depend on your individual situation, whether your child needs to continue some of those chronic medications. I think diabetes control in this time is really challenging because your child is at home and around food all day instead of at scheduled times. And so you'll need to be particularly cautious if your child is an insulin-dependent diabetic about allowing too many snacks and really making sure that their blood sugars are in control.
So I know we're getting close to wrapping up, but we had one question that came in again about masks with children.
Yes.
Do you have any advice for helping children understand the importance of wearing a mask during COVID-19 and explaining what coronavirus is to them? This was specifically geared towards younger children, ages 5 and under, who may not be school age yet and don't have the comprehension level.
So I actually have access to a coloring book that maybe we can post that someone developed for her children about this virus. And I think it's a really good coloring book, and it kind of is a way to go through step by step what we're going through. It's really helpful. Young children like to be in charge of what they do, just as we all do. And so just as you might ask your child, do they want to wear their green shorts or their yellow shorts today, you might have a variety of mask options and let them, perhaps if you have paper ones or if you have some Sharpie markers, let them do a little decorating on their masks. Sometimes can help them have some control over wearing the mask. Do be sensitive to, their complaints about masks being too tight or uncomfortable. Sometimes the elastic can cause an irritation behind the ear if it's one of those ones that go that way. So, be sensitive to their preferences for which mask they'd like to wear. And really just, I think it's just a matter of repetition and making a bit of a game of it and allowing them some choices. About all I can suggest. No magic answers there.
Well, we are going to wrap up our conversation. I know Dr. Mouzoon has patients to see this afternoon as well. So thank you everyone for tuning in to our final Care Connect conversation for this week. This week was focused on pediatrics, but we will be picking up our conversations again next week as well. On Monday, we are going to have a Kelsey-Seybold dermatologist join us and talk about skin care and skin conditions during COVID-19. I know a lot of people are worried about, their hands becoming dried and masks irritating their skin. So definitely tune in to that on Monday. We'll have some great tips and advice from one of our physicians on that. And if you have any questions about COVID-19, we do keep the most up-to-date information that we have on our Kelsey-Seybold website on our homepage. So you can go there. That website is kelsey-seybold.com. And we also have a 24/7 contact center. So if you are showing signs of symptoms or coronavirus, please feel free to contact us if you are a Kelsey-Seybold patient and have any questions. That number is 713-442-0000. And as we said before, we have nurses available 24/7 to help talk you through any concerns you may have. And they can also page the on-call physician if need be with any follow-up questions. So thank you again, Dr. Mouzoon, for joining us. And we hope everyone has a wonderful weekend, and we see you next week for our Care Connect Convo.
And I'll send you the link right now for that comic book.
Thank you.
Our coloring book.